Samaritan Athletic Medicine Center is a really unique facility in that it's a shared collaboration between the hospital system, Samaritan Health Systems, and Oregon State University and the athletic department. So we do a lot of interaction not only with community members for their health in terms of sports medicine and orthopedic care, but also with student athletes, as well as research and teaching. I've had a lot of experience with orthotics, not only myself as a runner and some foot issues I had while running, but even as a sports medicine physician, and have seen the benefit of it in both not only the injured athlete, but also in terms of the uninjured athlete or the community industrial worker who needs to have that support in their feet. Because really the foot is the whole foundation that all activity is done on in the human body. Previously, before we started using the Phits system, we would either have them just step in a foam box, or we might even kind of cast them in a non-weight bearing fashion and send that off to have a mold made. It would come back, and then we would have to kind of fine tune it and adjust it. And so this has added a much more streamlined process for us. The great thing about the Phits foot scan system that is new that we haven't really had before is it allows us to have really objective measures when we do a foot scan. So we take all of our student athletes, and as they come in, and we begin to start screening them for possible injury risk using that foot scan system and the injury prediction model that's included in that, which is very, very helpful early on in trying to help identify those who may be at risk. I like to make decisions based on hard data and evidence, not what we think might work and what we think might happen. And so it allows us to really have really good numbers and number-based information in making decisions and making our decision on what we're going to do to help that athlete. We can really break down in a much more detail how the foot mechanics of that individual is progressing through the game. The software is actually very intuitive. It's pretty easy. Once you turn the system on, upload it, and start gathering data, it helps clean the data pretty quickly, automatically, and then it's real easy to fine-tune what changes you want to make on the orthotic as you go through the ordering process. So it's not a hard, complex system to learn. It's very quick. It takes up to maybe 3 to 5 minutes to really completely scan somebody and gather the data. Usually the software is pretty dead on. Occasionally we'll add a little bit of a wedge or some small adjustments that we would normally do after an orthotic was made, that we can go ahead and try and build that into that 3D printing model early on, as opposed to trying to do aftermarket adjustments. Because the data is collected and then demonstrated on the screen live, real time, and you can look at that interpretation immediately, it's very easy to do the scan and then actually review it with the patient or the athlete, because it's such a custom fit with the 3D printing model that really we've had very little need to do any kind of modifications or adjustments afterwards. And patients put them on and start wearing them, and they're comfortable right away, which is not real common with orthotics in many cases. Predominantly, we've been using it in basketball and in football and soccer. So we tend to choose athletes whose demands on their feet and on their footwear are great enough that they really do stress the shoes and footwear to their maximum, and we feel that this provides added benefit to that. In our experience so far, we haven't had any breaks or any failures of the product whatsoever. Obviously, the student athletes are putting a lot of demand on their feet, and they go through multiple pairs of shoes in the season, and yet we're still able to maintain one orthotic.